Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Welcome to another episode of Ask the Chiropractor. When you have a question about chiropractic or chiropractic care, the only qualified person to answer these questions are a chiropractor. Now, this is part 4 of a thing we did this month, tried to do a whole month on one topic. The basic topic is, why are more people seeking second opinions from chiropractors? More and more people are coming into us after getting a medical diagnosis and wanting to talk to us about what they just learned and want to know whether or not chiropractic could help them. I guess in theory, my message about if you don't know who to ask a chiropractor is actually starting to work out a little bit. So what's the difference? Basically, when you go to a medical doctor, there's a protocol. And the protocol usually, let's treat your pain. They usually start off with NSAIDs, non-steroidal anti-inflammatory drugs. Now, the research is very clear on these. The more of these you use, they develop chronic headaches and lower back pain. The majority reason why people seek medical advice. So taking these chronically leads, we know for a fact, the chronic use of them, meaning that you've been using them for a long time, the side effect of that is lower back pain and headaches. If that doesn't work, they might give you a steroid burst and a muscle relaxer. Now, my personal philosophy on muscle relaxers, your muscles are in spasm to keep you from slamming the inflamed joint more and more together. So when you take a muscle relaxer and the muscles relax, you're allowed to slam that joint together more and more. And in my opinion, that could be not beneficial, but more harmful. Now, the steroid burst is meant to get rid of the inflammation. I have no quarrels about that. And that doesn't work, then they send you to physical therapy. Now, in previous podcasts, you can go back and listen. We've talked about the fact that the recent literature has stated there are 4 types of muscles. When I went through school, we learned 3. We learned skeletal, smooth in your blood vessels, and cardiac muscle in your heart. Today, they're saying there's a 4th type called stabilization muscles. These are the muscles around your spine. The muscles around your spine look like skeletal muscle when you do a gross dissection lab. However, under a microscope, they look very different. They have tremendously higher number of neurological innervations, significantly more, 200 plus more per square millimeter than other muscles in your body, because these muscles' job is to keep your eyes level at all times. If you listen to my podcast, I often talk about the righting reflex, R-I-G-H-T, righting reflex, and that says your eyes stay level with the horizon at all costs. So when people come to see me, they have a kink in their lower back. They usually have a kink in their neck to balance themselves off in order to correct the righting reflex. If you watch an athlete move at high speed, you'll see their eyes stay level the whole time. This is all the stabilization muscles. If you're doing physical therapy and your physical therapist is not up to date on the research and treating your stabilization muscles, but using old-fashioned physical therapy instead, then they're missing the point and the physical therapy does not work very well. So if you've already tried NSAIDs, muscle relaxers, and old school physical therapy, we'll say, and that doesn't work, the good news is the next thing they have is injections, the shots they give in your spine. Now, what's interesting to me is, to my knowledge, these are not FDA approved, nor FDA recommended for the spinal area. Why? Because of the reason I just said, the musculature is different. The manufacturer doesn't recommend them around the spine. Why? Because like I just previously said, we've realized this is a different type of muscle. They respond different. Do cortisone shots work wonders in the shoulder, the hips, and the toes, and the knees? Yeah, I've had some. They do pretty good relief. They relieve the pain. They make the joint go back to where it was. I can't say they don't. I've had them done myself. However, the spine is different. And lastly, if all this fails, they have surgery. Now, I have a pretty biased opinion on surgeries because I don't see the good ones. I only see the bad ones. But we have a lot of patients with spinal surgery. The problem with spinal surgery is the ones above and below the surgery move extra more and they get worn out faster now because the motion has been taken away from the ones that were surgically fused. So that's their system. Our system's different. Our system is going to look at the structure of the spine, how the spine moves biomechanically, how it behaves with your nervous system, your posture, and the righting reflex So chiropractic takes a different approach to your spine. We don't always want to treat the pain right away. We want to restore the function. If we can restore the function, the pain should go away. Pain is simply telling us that there's something not right that needs to be fixed. We will look to make the correction. And when we do, there's all kinds of great benefits on the nervous system. So we look at things with a different lens. We look at things with a different approach. We're not the let's get rid of the pain. We are more let's restore the function. That's why our approach is different. Now, what does a chiropractic second opinion look like? You went to the doctor, you have an issue. With a chiropractic second opinion is that we want to see your posture. We want to see how you move. We want to have you probably lay face down, turn your head this way, turn your head this way, lift this leg, lift that leg. We want to see how it works. The whole spine moves at once together to get an idea of where the fixations are and where the fixations aren't. Where are you locked up? What is causing all this problem? We want you to bring your x-rays with you. If you've had x-rays done somewhere else, bring them with you. We can look at those x-rays. Your medical physician, the radiologist there, looks at them for fractures and tumors and bad things, and that's awesome. Everybody should. We do. We look at them for those things. But then we go a step further. We go a step beyond what the radiologist does. We look at it chiropractically. We look to see how you look in a weight-bearing position. What do the joints look like? Where's the compensation? If this is rotated here, how does this affect this down here? A really good example of this is the top bone in your neck, the C1, C2, the top two. The C2 has a great big spinous process, great big bump right in the bottom of your hairline. From there, the muscles go up and attach to the base of your skull on the backside. But they also go down to your shoulder blades. So that C2 should go left or right. It's going to pulling in the back of your head on one side, but it's going to pull on the opposite shoulder too, causing problems. Now that can make your head posture go bad. Then when your head posture goes bad, the median scalene muscle that goes from the angle of your jaw down to your collarbone, that muscle gets mad. When that muscle gets mad, it gets inflamed. When it gets inflamed, it gets sticky. When it gets sticky, the nerves that come out of there go down your arm, get impinged, and that causes numbness or tingling or weakness in your hand or pain down your arm. That's what we look at when we look at your x-rays. So we're looking at so much more. Another example of why patients seek the chiropractic care differently, we look at your lower back. Maybe your L1, L2 is rotated. These nerves come out, they innervate your small intestines. Maybe you've had a lot of bowel issues. They also control the muscles that go down attached to your pelvis. Can rotate your pelvis to the left, rotate your pelvis to the right, pull on a muscle called the piriformis, get that all inflamed, and in that case, the sciatic nerve comes out and hits that muscle and can mimic sciatica. Or maybe your lower back's out and you have sciatica. So we look at different ways to determine the same thing, because people could have sciatic pains from the L1 being out pulling the pelvis in the piriformis muscle, or they can actually have classic sciatica where L4, L5, and S1 are a problem. Just like up in your neck I talked about before, the C2 can move, cause a cascade of problems, or maybe just your C5, C6, C7, T1 are misaligned, causing nerves on your hand. The symptoms don't tell us that. The imaging does. The chiropractic exam does. And only chiropractors are trained to look for these things. Another reason why people don't come to the chiropractor first, that's the thing we hear a lot. I should have came here first. I wish I would have came here first. Why? Some people think they have to be referred to us. They have to have permission to come see us. You don't. In Illinois, we're primary health care providers. You can just walk in my door any day of the week and we can start care. That's the unique thing about chiropractic compared to some other areas. Now, physical therapy has become primary where you don't need a note anymore. For a long time, you had to have a note from your doctor to go see physical therapy. Now in Illinois, you don't. So you can come in, you don't need permission to get a second opinion. You just come on in and talk to us. So we'll take a look at it. So if you're waiting for a medical doctor to refer you, they really don't, because I know where I live, we're not part of the healthcare system. Meaning that the doctors in healthcare system X refer to only doctors in healthcare system X. Doctors in healthcare system Y only refer to Y, and Z only refers to Z. And we're W over here, right? We're totally on our own. We're not part of that system, so you're not going to get that referral to us. So it's up to you to come in and get a second opinion. And again, you can ask the doctor if you should see a chiropractor, but you have to remember they don't know what we do. They never were educated on what we do. A lot of people just assume the medical doctor was educated on everything. I can tell you, working with the team, with the hockey team here for many seasons, they don't know what I do. Often, sometimes I try to say I know what I do, then I ask them 4 or 5 questions and they don't know what I do. No more than I know how to do surgery on your shoulder. Do they know how to adjust the upper cervical spine, or why we adjust the upper cervical spine, or what we're looking for before we determine the upper cervical spine needs an adjustment. These are things that they can't answer. So to ask them whether or not they need care doesn't really make a lot of sense. But we've had a lot of patients come in that were getting ready for surgery. I mean, we've been here since 1949. So we've had a lot of patients that come in and they were told to learn to live with it. And we were able to get in there and start making chiropractic care, and we were able to help them from needing that. Now, it doesn't happen every time. Sometimes your spine's too far gone. Sometimes you waited way too long to come see us, and the spine's degenerative, got big nasty spurs, and we tried. But come see the chiropractor, see whether or not before you dive into things. Talk to other chiropractic patients, see what their experiences were. So let's talk about it. You've been to the doctor, you've been told you have a situation. It could involve your spine, it could involve your nervous system. They want to go in a certain direction. Maybe you don't want to dive into all the drugs and surgeries and shots and injections and physical therapy before you talk to a chiropractor. All you got to do is walk into the chiropractic office, tell them what's going on. In Illinois, we can get your records from wherever you were. You don't have to bring them with you. Sometimes we can even log in and just see them. Sometimes our systems are connected. You can ask for a copy of your imaging while you're there. You don't have to even say who it's for. Just say you'd like to keep a copy of all your own records. They'll give it to you. And bring it in here, let us look at it. Let us give us our 2 cents. Then we'll be brought into here. We have a free consultation where we meet with you. We go over your own records. Now, we might still have to take some more x-rays. We might still have to do some more exams before we can get a definitive answer. That's going to be on a one-to-one basis. Every case is unique. Every case is different. So you want to come in and see us. So the biggest thing you have to remember when you go see a chiropractor, just remember, it's all about taking a different perspective. We're not trying to see how to mask the pain, how to cover the pain up, or trying to treat the pain. We're trying to look at what caused the pain, what created this, why is your body behaving this way? And we're really concerned about how you feel today, but we're also more concerned about what it's going to be like life in 10 years from now, 20 years from now if you ignore this. So bring your records in, get a second opinion from a chiropractor. You can even start with a chiropractor. There's no rules against that. You can come see us first. We'll give you a copy of our x-rays to take with you. So you can take it to your next healthcare provider if you want a second opinion from a medical doctor. But come on in, meet with us, talk to us. And remember, if you have questions about chiropractic or chiropractic care, the only person qualified to answer such a question is a chiropractor. Go ahead and leave a comment below, a question below if you have one you'd like me to answer. Next month, we're going to go into a different topic altogether. We just want to try something fun this month. So go ahead and leave your question below, and we'll get to you. We'll get back to you wherever you're listening or watching this. And again, thank you. And remember, only a chiropractor knows whether or not chiropractic care can help you.